And so these are some of the imaging studies that we sometimes get on patients with brachial plexus injuries, showing that there can be concomitant injuries or injuries that happen at the same time, such as a humerus fracture. But we often sometimes see a clavicle fracture associated with brachial plexus injuries. We don't see that on either of these x-rays. And this just shows an MRI being, these two images are linked. These white areas are filled with cerebrospinal fluid, the fluid that bathes the brain and the spinal cord, and where there was a tear in the lining. And you can make out to some degree the rootlet that contributes to that root there, where there's likely an avulsion injury. And again, when we do MRI of the brachial plexus, the nerves that make up the brachial plexus, we'll oftentimes get an MRI of the shoulders as well to see how well the humeral head lines up with the scapula. Again, similar images and the details associated with MRI and how it is oftentimes, sometimes controversial as to whether we get these studies done or not, as they, in the babies, require usually anesthesia to get a good study done. But they do allow us to evaluate the shoulder anatomy, and most of us generally get them after 3 months of age as a tool to help with decision making when it comes to possible surgical intervention.